Hello, everybody. We are going to get started right on time today because we have a lot of information to get through. Whoops. And we will be making sure. There we go. We've got a lot of information to get through. It's probably going to take over an hour. I've tried to cull it down as much as I can, but there's a lot. But I will make sure that I will happily stay on and answer questions at the end for as long as needed. And if you need to dip out because you've got to get back to work, that's absolutely fine because you'll be sent a recording of this as well as a copy of the slides. So let's get going. Welcome, everybody, to our Health Professionals and Support Services Award specific award changes session. Today, we'll be talking about a lot of things, but specifically focusing on what you'll need to do for the 1 July increases, but what you'll need to do to prepare for the 1 October changes. Before we get started, I'd like to acknowledge the traditional custodians of the lands that we're all meeting on today and pay respects to elders past, present, and emerging, and extend that to any Aboriginal or Torres Strait Islanders that are with us today. Who am I? I'm the director and founder of Strawberry Seed Consulting. I've been in HR for a very long time, and I'm very much been engrossed in what the changes of this award for the last few months. This is my team. This is what they look like this time of year. This is our busiest time of the year. We've got about over 150 audits that we're already doing, and that's before other people that aren't on packages come in and look for help. And obviously the changes this year with the Health Professional Awards has made that go up, so that we are already up to our eyeballs in spreadsheets for this time of the year. So today we're going to cover what's happening around 1 July, what to prepare for 1 October, how they're going to interact together, and really try and give you a bit of a deep dive on understanding the new structure and answer some of the questions that you guys put in when you registered. So really briefly, why is this happening? Well, the Fair Work Commission found that work performed by health professionals has been historically undervalued. Now, they did a review and they identified 5 awards as a starting point. And that was part of their gender-based under-evaluation and review. And Health Professionals Award was one of them. So the aim is to have better recognition of qualifications, professional responsibility, judgment, and skill in industries that as a whole have a larger female component. There's already been some changes put in place. Back on the 1st of April, there were some new classifications added into the support services stream, and pay rates were already updated, and that applied to mainly dental assistants and pathology collectors. So unless you have someone in your business that has those, then everything else has stayed pretty similar when it comes to support services. But what's now been finalised is the final determination has been dropped, which means that they have confirmed that this is what the changes will look like from the 1st of October, which will be a new classification structure, which is based on the AQF qualification framework. It'll mean an increase in minimum rates of pay. There's some translation arrangements, retained pay protections, and staged increases over the next 5 years. And we're going to break down a lot of this today for you. So there's 2 main important dates that I really want you to remember. The first is the 1st of July 2026. And really this year, on the 1st of July for you guys, is no different than any other year because the increase to the award has been 4.75%. That will apply from the first full pay period after the 1st of July, and that will be applied to the current award rates. That the new award changes do not come into the 1st of October. They are not in the current award. So all you need to worry about for 1st of July is that when those new rates drop, that you check to see that people are still paid correctly. Then when we move to the 1st of October, you need to have been ready for this new classification structure and understand what it's going to mean, how it's going to impact your employees, and we're going to break all that down for you. What I really want you to think about though is that this is a structural change, not just a tweak. So it's a brand new classification framework. And I've seen questions like, oh, well, how do I explain to my employee they were level 2, now they're going to be level 1? It is not apples and apples. It's apples and oranges, or probably apples and carrots. You know, we're shifting to a different way of classifying. Personally, I think it's a lot simpler. It's going to be a lot easier moving forward. And there's kind of the transition period, but from the 1st of October, that's what's going to apply. So it's really important that you understand it. And as I said, I think it is simpler. I think it is going to be easier in a lot of ways, but it is a big change for how this industry has done it. And so I expect that there'll be a bit of pushback from people who don't understand it. So you can always send them this if you need to explain it in more detail. Right, so let's start with the 1st of July increases. The minimum wage has been increased to $26.44 per hour or $1,004.90 per week, and the award minimum wage has been increased by 4.75%. We all know that, it's been announced a couple of weeks ago. These increases will apply from the first full pay period on or after the 1st of July. So what does that actually mean? So the 1st of July is a Wednesday. If your pay period is Monday to Friday, and so the pay period for that week of the 1st of July would have started on the 29th of June, it doesn't apply to that pay period. It applies to the first full pay period on or after. Now, if your pay period is Wednesday to Tuesday, then it will probably start on the 1st of July. And I mean, if you're fortnightly and your pay period starts on the 29th, then this won't come in until your next fortnightly on the 13th of July. So it's really, really important that you understand when it does come in. It's not just automatically from the 1st of July, it's the first full pay period. Now, one of the biggest questions we get is, do I have to increase everyone by 4.75% on July 1st? And it's a valid question because a lot of people see it in the news, employees will see it, the announcement, it's in all the media. Oh, well, I'm getting a 4.75% increase. No, the minimum rates in the award are getting a 4.75% increase. That is where that happens. So what does that mean? The first question you need to ask is, are you paying award minimum? If you're only paying the minimum that the award says you must pay, then the answer is yes, you will have to increase to the new minimum rates from that first full pay period because you will be underpaying if you don't. However, if the answer to that is no, then it's not necessarily, and I'll explain why. So if you're paying people above award, and there's a lot of different ways you can pay people above award, there is a bit of a common misconception, as I said before, that some people think, oh, everyone should get it, but it doesn't. That's not actually the case. What you need to do if you're already paying above the award minimum is to work out whether or not and check whether or not you do need to make a further increase, because won't be a legal requirement unless that increase will mean that you drop below the minimum award rates. So if you're in that situation, how do you check it? Well, first of all, mate, why would you check it? You would check it if you're paying people a flat rate for all hours worked, an annualized salary, maybe a rate that you're saying is inclusive. It's inclusive of overtime, it's inclusive of allowances. Again, just because if you're paying above the award, but you're not trying to use it to offset anything, then you just need to check the rate. But as soon as you start trying to say things are included, you need to be checking it every year, regardless, because that increase now was 3.5% last year. We're talking about nearly 9% in 2 years. If you haven't looked at your rates since July 2024, and you were above the award, it's quite possible you might not be anymore. So it's really important that you do those checks, and you need to make sure you're paying enough to pay for everything, not just the minimum rate. And that's called a better off overall test. Now today, I am not going to go through the better off overall test. Last night we had our general all industries award increases webinar that we have every year. And I went into detail a little bit about how to do better off overall tests. I also talked about a number of other different items that I'm not going to cover today because we have so much to get through. So we'll add a link to last night's if you want some more general information about how to check things and things like that. But I'm not going to go through that today because I want to spend my time on the 1st of October. So let's get into it. A couple of key definitions I want to go over first. The first one is AQF. You're going to hear this, Australian Qualifications Framework. You will hear this and you'll read this a lot because that is now the core of how classifications will work. And what that is a national system that ranks qualification. Every qualification in Australia has to be registered with the Australian Qualifications Framework, and it is given a level. So an AQF level, so level 4, level 5, level 6, level 7. And that is what is the now central premise of the whole classification system. Now, a classification is the level that someone's role sits at under the award, and it determines their minimum pay and progression. Years of experience is the time working in the profession, not just with their current employer. And that's really important because these are some of the things people get wrong. You have to understand what classification your employees will move to. And part of that is going to be years of experience. So you need to actually make sure you know exactly how many years they've been working in the profession, not just for you. So what's our current system that will be in place until the 30th of September? Pretty much all professions are classified the same with no differentiation. And employees will start at level one and progress based on years of experience. Where they start in level one is really the only difference because that's based on the qualification they enter. Is it a 3-year degree, a 4-year degree, a master's, etc. It's fairly vague and ambiguous, moving through the classifications, and the more experience someone has, the more vague and harder it gets. And the minimum rates increase on the 1st of July each year. That's going to continue. There is still going to be an increase on the 1st of July each year. And the 4.75% increase that will apply to the current award rates will also apply to the rates that have been published in the final determination. So that's important to remember. But from the 1st of October, the changes come in place. So classifications are going to be determined by qualification level, so the AQF, professional experience, nature of duties, seniority, and specialist responsibilities. And we're going to break that down for you. Now, we start with the AQF levels, and what's really important to understand is that Fair Work has already determined and published the AQF levels for each profession in the award. It's added some new ones as part of this review process, and I'll talk about what happens if you don't have one identified, but that is published. It is, it's basically there to tell you what it is. It's not up to you to go and work out what it is based on the employee's qualification. We've already had some questions where employees have gone and said, well, I'm going to be this because this, I've looked and I've checked. Whatever the awards, the Fair Work's done the work for us. Now, so the new structure is going to determine somebody's classification based on the qualification level that has been allocated to your profession. So it's really important that and so now each level is going to have different rates. So it's not a one size fits all approach anymore. And Schedule B is the Common Health Professionals and Standard Minimum Qualifications. That's where you find that information. And it has been published on the Fair Work website in the final determination. And I will link to that when I send this through. So what are the steps that you're going to need to follow to determine what classification somebody is? Also, I've already forgot to mention, if you have questions, please put them in the Q&A box and I will go through as many as I can at the end. And I'll do them at the end because I may answer your question. So, is the profession listed in Schedule B is your first question. Now, it contains a list pretty much of similar to what was already there. There's a few changes and differences. And an AQF level has been allocated to each profession. There's just a couple of examples there. If only one AQF level is listed, the employee starts at that level. So here's an example here. We've got Sarah's a physiotherapist. Schedule B says a physiotherapist are AQF 7. Sarah is classified as a health professional AQF 7. Full stop. There's no debate about that. These levels were put together based on the minimum entry requirements into the profession. They listed, everyone's had the chance to complain about them or make suggestions about them. Fair Work only made a very small number of changes on the final determination. Chiropractor was the only one that I saw. I mean, I didn't look in detail at absolutely everything, mainly the ones we work with a lot. And chiropractor did get moved from a 7 to a 9 based on their submission. But that is set in stone now. You can't, you won't be able to change that. So we've looked up on Schedule B, we've worked out what AQF level we are. What if there's more than one level listed? So there is a handful of professions that have been listed with several levels. And there's a couple of examples there, dietitian and speech pathologist. So if that is the case, then it is determined by the qualification that the employee holds. So if you have a profession that with either 7, 8 or 9, and the employee's qualification, so Jane has an AQF 8 qualification, she will enter at AQF 8 because that's the qualification she holds, and there's 3 listed for your profession. That only applies when there are multiple levels listed in the award for your profession. You can't just do that across the board. All right, third question. What if the profession isn't listed at all? And that's a question we've already had, and we're already looking into in some elements. So it's not intended to be a list of every possible position that could ever be worked. So there's a couple of things that can happen here. You identify the standard qualification normally required to enter that profession, determine the AQF level of that conversation qualification, and then use that AQF level. Now, what's always been done in the past is that you kind of look for the closest profession that and kind of use that as a guide and go by that. Now, one of the things that we're looking at the moment, for example, is for exercise scientists. So exercise scientists aren't listed. They can work in lots of different industries, but if they can come under this award. Generally, in the past, people have just kind of gone with what the exercise physiologist was, but it doesn't really matter because the old system kind of accommodated that. In the new system, it's not listed. So we're actually been talking to Fair Work about the fact that it actually has an AQF 5 or 6 off the top of my head level qualification. So, and exercise physiologist is level 7 or IQF 7. So one of the things we're doing is going back to Fair Work because someone has identified that there's another classification profession listed in the award that is probably more aligned to the qualification that is required for that. So we're going back and getting a bit of clarification on that. And there's probably going to be a little bit of that because it does make a bit of a difference now. And obviously, if you've got some people in a profession that is, a couple of AQF levels down to everyone else, most people are not going to be wanting paying higher rates. So we're looking into those. If any come up for you, we're more than happy to sort of do some research on that because that benefits us as well. But if there's absolutely nothing listed, then you kind of got to determine what is the minimum requirement to enter that profession. And so if a new allied health profession, has kind of a new stream of something has come up and it hasn't really been reflected in the award yet, and it requires a bachelor degree to enter into that profession, then it would generally be treated as an AQF 7. But I wouldn't make assumptions. I always get it checked. Step 4. What if the employer requires a higher qualification? So the only time that an employee would be entitled to be classified at a high AQF level is if you as the employer said that is what this person must have to do this job. So an example here is you've got a profession that normally requires an AQF 7 bachelor's degree entry. So it could be a physio, it could be a podiatrist. However, for this particular specialized role that someone's got, they are saying that we will only accept people who held a master's degree for that job. So if that's the case, because the employer has said you must have a master's degree and we will not hire you if you don't have a master's degree, AQF 9 would be the appropriate level to look at because that's the level that the employer has made compulsory. So, there are lots of professions that have multiple different types of degrees that someone can enter with. Just because they have that higher qualification doesn't mean they automatically go up. But if you have said that I am only going to hire someone for this role, I've deliberately asked in that advertisement to say that this person must hold a master's, and if they have anything less, I wouldn't hire them, then they need to be looked at AQF 9. Effectively, as an employer, you're kind of raising the classification level by saying that's the minimum requirement for that role. So a few assumptions you want to be careful of. And I've already heard these. Some people might assume, well, I have a master's degree, so I must be AQF 9. And that is not necessarily correct because the award is primarily looking at the qualification required to enter the profession, and they have listed that for many, many, many professions. So not every qualification an employee has obtained during their career is taken into consideration because and to be honest, the AQF is only used at level 1 in the new system, when you're first entering the profession. So the master's degree itself will only become relevant if it's linked to the AQF level that they're listed as. So say, for example, they're a psychologist, they are AQF 9, or the employer requires that, as I just discussed before. So I want to deep dive into the definitions of these new classification levels because I want to try and avoid as much confusion and give you guys as much knowledge as possible to be able to use when you're also talking to employees that might have a different view. So level 1 is where we start. It's still 4 levels. Every health professional will start at level 1. It shouldn't say most. They will all start at level 1. So you'll be classified at level 1 because you're qualified to work in that profession and you're performing the normal duties of that profession. And there's 2 things that will determine what your minimum rate will be. The first is the AQF level. So if you're in a profession that is AQF 8, then you start on AQF 8 and you use the figures for AQF 8. If you're in a profession that's AQF 7, you start and use the figures for AQF 7. And then once you have that level of AQF, then it's determined by how many years of professional experience someone has within that profession. So level 1 is now going to be broken down into the first year, second to third, fourth to sixth, and 7 years plus. The biggest change here is progression is now not automatic through levels. You progress automatically through the level that you start in. But if you get to 7 year plus and you do not meet the criteria or definitions for level 2 or 3 or 4, then you'll just stay at you'll just stay at level 1. And that's okay. And again, remember, we are talking about the minimum wages for these professions. But that's the biggest shift in mindset is it's no longer just I continue to move through. It is I start, I progress based on my years of experience. If and when I meet the criteria for the higher levels, that's when I will go up. But if I don't, I might just be, the AQF, 7th year plus is going to go up every year by the minimum wage. It's not going to stay stagnant, but you're just not going to progress just because you exist. These figures are the ones that have been published. They are not including the 4.75% increase. That has not been published yet. So there is a big change to how progression will work though, because up until the 30th of September, employees will progress as they currently do based on experience-based pay points on a pro rata basis. So if you're a part-time or a casual employee, you progress based on the full-time equivalent. So if you are a 0.5 part-timer and it would take you 2 years to progress up a pay point because it would take you 2 years to get the full-time equivalent hours. So it means that employees working fewer hours can take longer to progress. That is going. That is not going to be gone from the 1st of October. Once the 1st of October hits, people will now progress on years of professional experience. So whether you're part-time, full-time or casual, and you started in 2024, that was your first year, and you worked for that full year in working as a podiatrist, then regardless of how many hours you work that year, in year 2, you will progress up to the 2 to 3 year part. So it's not linked to full-time equivalency anymore. It actually makes it simpler to be able to progress people through, but some people I'm sure will have an issue with this because part-time employees are progressing at the same rate as full-time employees. So an example here is when you've got two physiotherapists, one's worked full-time for 3 years and another's worked part-time for 3 years, they will both be seen as having 3 years experience under the new structure. Level 2 is where I'm going to spend the most time because level 2 is, I think, where we're going to have some of the bigger issues. So level 2 is for health professionals who have responsibilities beyond a standard clinician role. You do not move to level 2 simply because you gain experience. You can have 10 years experience and not be a level 2. You must be performing duties as per the different classifications here of senior clinician, specialist, supervisor, and educator, and I'm going to break those down for you. So, senior clinician is basically an experienced clinician who works in an area requiring advanced knowledge, expertise, or clinical judgment. What does that mean? So they might work in a specialised clinical area, they might perform advanced practice work, they may hold a postgraduate qualification, they may not, but they may, and they may provide guidance and support to less experienced clinicians. But not one of those in a particular is like the only trigger. It's an overall feeling of, does this person meet this? And what's really important to note when you look at the figures is it used to be like when you went through on the current system, pay point 1, the top of pay point 1, level 1 pay points, into the bottom of level 2 pay points. It was kind of just a continual slow adjustment up. At AQF 7, there's at least an $8 difference between the top of level 1 and level 2 because it's intended to be, you meet some specific criteria. You're actually, senior clinician just doesn't mean I've been here for the longest time. So it's important to note that they may not hold a postgraduate degree, so it's not automatically required. The focus is really on the work that's being performed, not just the time someone's been in the job. You could be a great exercise physiologist and you've been in your role for like 8 or 9 years, but you're just coming in and doing kind of pretty stock standard stuff all the time. And that's okay, but it doesn't automatically make you a senior person. And that's going to be a mind shift for a lot of people. Now, a specialist performs work requiring expertise in a particular area. Their expertise may be clinical or non-clinical. So, for example, they might be doing research, they might quality assurance, clinical governance, program development, specialist project work. Those kind of things can make someone a specialist. You will have people that say, but I think I'm special, I'm a specialist. You have to come back to, and I mean, this is not the exact definition. You need to come back and read through it and really make sure that someone is, if someone comes to you and says, I think I should be senior or I think I should be a specialist, then ask them why. Ask them to justify why. The third one I'm going to go through, because I'm going to leave the most detailed one to last, is an educator. So an educator is responsible for designing, delivering, and evaluating education programs. It's a bit beyond simply like, onboarding a new staff member. It's about accountability for educational outcomes. So if someone is working around those spaces, then they would be a level 2. Now, some examples of those three. A senior clinician, you've got a senior occupational therapist who mentors junior therapists and manages complex neurological cases. They would probably be seen as senior. Specialist, a speech pathologist responsible for developing and reviewing clinical quality systems across the organisation, could make that person a specialist. An educator is a clinical educator responsible for orientation programs, competency assessments, and professional development across a whole clinic group. That would be an educator. So again, some of these will evolve over time. They're new definitions. They've improved the definitions. There is still going to be a degree of, I guess, autonomy to sort of decide for yourself. But just because you call something, give someone a title of senior doesn't automatically make them senior. What someone's title is within the organisation does not link to what the classifications are directly. I mean, you can if you want to, but it's really important that could be a bit of a sticking point for people. Now, I'm going to deep dive a bit on supervisor because this is the one we've had a lot of questions about. A supervisor has the day-to-day responsibility for overseeing other people. Now, the key phrase in this definition is they're required to provide supervision on a day-to-day basis. So there is a more formal, ongoing relationship with the distinction of being responsible for that person. So, it's like, well, people ask me questions and, I help other clinicians. That's not supervising. I'm responsible for supervising these employees, or asking the question, am I formally responsible for supervising other clinicians or employees or students on an ongoing day-to-day basis, not just somebody has a placement. They're very, very different questions. So examples could include where the employee is expected to be directing someone's work activity. So if you're supervising someone, you're responsible for allocating their work, monitoring their workloads, reviewing their performance, and ensuring they're meeting standards. You're the person that is supervising or managing them. Another form of supervision is providing ongoing professional supervision. So if you have someone within your business based on your profession who is formally supervising other people and they're conducting regular supervision meetings, reviewing clinical decision making, signing off on competencies or monitoring development plans, they would be considered level 2. Now, what is probably not a level 2 supervisor? Someone who's doing informal mentoring. So if you've got a senior clinician who's answering questions from junior staff, sharing their knowledge, providing guidance, or helping your employees settle in, that's not supervising. Only supervising students, and this is where I think you'll get a lot of 3 to 4 years out going, oh, but I'm supervising. I look after students. Are you responsible for managing those students? And if you're only responsible for managing students on placement and maybe giving them some feedback and signing the documentation, that doesn't make you an ongoing supervisor with day-to-day responsibilities for an employee. And just being the most experienced clinician, you might be the go-to, you might be the most senior person there because it's a new and growing business and you've got one person with 12 years experience and then you've got, a whole heap of graduates. And just because people go and ask you questions doesn't mean you're supervising them or managing them. A couple of examples. So we've got Michael is an occupational therapist. He's responsible for managing and supervising 3 clinicians. He conducts regular meetings with them. He monitors their standards. He provides feedback. He oversees student placements and has ongoing responsibility for clinical supervision. He would be level 2. Emma is a senior physiotherapist. Graduate physios ask her questions a lot. She occasionally provides them with advice. She supervises a student placement a couple of times a year, but she has no day-to-day formal supervisory responsibilities. On that basis, she wouldn't be a level 2. And this is one of the things that you will need to do for people that, when we talk about mapping that map to level one, is you'll have to make sure that, the mapping might put them in level one, but you need to double check to make sure they don't meet any of these criteria. Now, once you are classified as level one, progression is based on employees' experience uh, when performing level two duties, not their total years in the profession. So, level two has two different levels within it. There's the first 5 years operating at a level two, and then after those first 5 years. So, it is split into two different levels. It's really, really important that it's not just a case of, hey, well, this person's level two and, you need to understand, well, how long have they been operating at a level two in a job that would fall under that? So if you've got someone who currently works for you and for the last 2 years they've been doing supervision, like with somebody, and you go, okay, well, when you do move them to level two, there'll be 2 years in level two, so they've got another 3 years before they move to 2.2. So just give you a bit of a sort of idea of what are the traps you might fall into. So employees may think, well, I have 10 years experience as a physiotherapist. I must be level 2.2 because they've been classified as level two. Um, the relevant question is actually, how long have they been performing level two duties? So if you've got a physio that's got 15 years experience, but they've only been really seen as a senior clinician or a specialist for 2 years, then they would be classified as 2.1, less than 5 years experience because they've only had that 2 years performing that work. This will get much easier as people start with us and progress through with us. And the mapping's already been done for existing employees, but we'll talk about that in a minute. Level three is for health professionals performing advanced professional or management responsibilities that are beyond level two. Again, you don't just simply move to level two because you've gained more experience. So they've got three different definitions: advanced clinician, senior specialist, and section manager. If you think about level three as being organisational influence, you've got a real advanced level of expertise or leadership responsibility. Again, not just years of service. So an advanced clinician demonstrates a high level of professional expertise and is a recognised leader in their clinical area. So they might manage highly complex cases, they might provide expert clinical advice within and outside of the organisation, they might lead advanced practice initiatives, develop clinical protocols, drive service improvements, or provide leadership across teams or disciplines. And again, the focus here is not just on the years of experience, it's about the work that they're performing. And if that work is requiring advanced expertise and judgment beyond a senior clinician role. A senior specialist performs work that requires highly developed expertise. So we're talking about a leader in research, clinical governance, strategy and quality development, service redesign, advanced specialist programs. Or they might be running organisation-wide specialist projects in larger organisations. So the employee's influence often in level three would extend beyond individual patients into broader organisational outcomes. And the third is section manager. The section manager has responsibility for managing a defined service team, program, or operational area. So that would include managing employees, but it would also include workforce planning, service delivery oversight, budget responsibilities, resource allocation, operational decision making. So if you're in a larger practice, there might be someone that looks after your state, or you might have quite a large section of the business that you manage, not just a team. So the distinction here is that they're responsible for managing, the section, not just individual employees. Some examples: an advanced clinician, you've got a senior physio, and they're recognised as the organisation's expert in neurological rehabilitation. They manage really complex cases and they lead clinical practice improvements. A senior specialist is, a speech pathologist might be responsible for clinical governance, quality assurance, and evidence-based practice frameworks across multiple locations. Or a section manager, you might have an EP team leader responsible for staffing, service delivery, workload allocation, and operational performance of the entire department. Level three employees are very much about influencing how services are delivered, not just how patients are treated. So it's that, level two is probably still at that patient treatment, where level three, it's very much they're influencing beyond the individual. Biggest trap that you might find for level three, employees think, well, I have 20 years experience, I must be level three. The relevant question is, are they performing level three duties? That's the biggest question. So the length of service does not create these. It's not about the how long you've been there or how old you are. The focus remains on the duties being performed, and because awards classify as jobs, not people. So the job that they're doing is really important. Now, level four is the highest classification. It's actually quite simple. A level four employee is a manager who has been appointed to a management role that requires criteria as specified in the award, and the sort of things that there are strategic leadership, organisational responsibility, significant management functions, and accountability for business outcomes. It's managing a business function, not managing people at level four. So it's actually just called manager. So if you're a level four manager, you're typically going to be looking after multiple teams or services, significant budgets, planning, being strategic, setting the direction for the business, organizational performance, and overseeing operational leadership. So you've probably got leaders below you that are doing the management of individuals. So it's a good way to think about it is their job exists beyond the day-to-day supervision, and it's about broader business outcomes. So we're shifting from clinical leadership to organizational leadership at level four. An example here is a regional allied health manager. They're responsible for multiple clinic locations. They oversee the team leaders and department managers. They oversee the budget. They're responsible for the planning of workforce across, their all their clinic locations. They're really operating at that more strategic level. And so they're influencing how the organisation functions rather than how services are delivered. So someone who's a level four will be having an organisation-wide impact. The biggest trap here is that not every team leader, senior clinician, or supervisor will be a level four manager. People might go, well, I'm a manager and I have manager in my title, therefore I need to be level four. Again, it's do you have genuine management responsibility and accountability for business outcomes, not just managing an individual team. Simply being part of, a senior person of a small team won't be enough, and it's the nature of the role. The title's not going to determine it, the duties will. So break it down really, really as simply as I possibly can. Try and think about that. Level two is I supervise, educate, or provide specialist expertise. Level three is I lead a function, program, or area of expertise. And level four is I manage or lead part or all of the organisation. So that's kind of a bit of a simple breakdown of it. Now, what about admin employees? As I mentioned earlier, these changes that we're talking about only affect the health professional stream. They will just continue in the same structure that they were before, unless they are one of those ones that changed back in April. But it's still important to check their classifications every year, particularly if you haven't for a while, to ensure that they're still in the right level for the job that they're holding, because jobs evolve over time, and it's important to check and make sure that the job hasn't evolved to a different level and you've missed it. So the transition. The transition itself has been mapped by Fair Work. They've actually laid it out for us. We don't have to make it up on the fly. So existing employees aren't going to start from scratch. There is transition tables that map how people will move from the current structure to the new structure. There are retained pay protections for people that might go down, because there are going to be professions that might be an AQF 5 that might end up being their minimums are now a lot less. But there are protections in place that you can't just drop their salary. But you must review all the classifications before October. Sorry, guys, I'm going to turn the I've got to put the air conditioning on before I start dying in here. So a really big key point I want to make as part of this transition is when you're actually looking at, you need to make sure you get the classification correct before you do the transition based on what's being provided by Fair Work. And you've got to confirm that their current classification is correct. Now, it's really important that you check this first before you do this. Don't just look at what you've done in the past. We see people set classifications in all lots of different and wonderful ways and just go, well, that's what it is. The purpose of this, you need to look at it like, okay, this employee, if we were coming in fresh, what would they be classified with based on their experience and qualification? So what qualification did the current system is what qualification did they have on entry? Because that is going to tell you what pay point they would have started at. So do they have a 4-year degree? Do they have a master's? Do they have a PhD? when they commenced. So you work out what level they would have commenced on, and then you work through their progression based on the full-time equivalent service. Now, why this is important, particularly for, in this award, because the way the current award works, once someone met the definition of level 2, they could progress up to level 2. Now, that could happen after a year, it could happen after 2 or 3 years, and Fair Work doesn't know that when they've worked this out. So what I'm suggesting and what we're doing for all of our clients is we are saying we are going to look at it, not take into consideration anything that might have progressed them quicker or further, and say, where would they have started? How would they have progressed? How many pay points would they have progressed since they started based on their full-time equivalent service? And we're assuming that they went through every pay point in level 1 before they progressed to level 2. That is the one you want to map across. We see people sometimes when we're doing audits that have said, oh, this is what I want to pay an employee, so therefore I've classified them at this level because that's what matches it. That could be a real problem. You could end up having people a lot higher than what they would have been. That's a bit odd, isn't it? So, how will existing level 1 employees be treated? Not level 1 and employees, just level 1 employees be treated. So, current level 1 and 2, there's a 2 missing there, will map to level 1. It's mapped, it's been done in the final determination. So to work that out, you go, okay, I check my AQF level, so I now know that this, we're AQF 7 because of the profession that we're in. How many years of experience does this employee have? Total years of experience, not FTE equivalent. And what duties are they performing? Are they doing anything that might tip them up to being level 2 criteria? You need to check that. But the mapping for everyone has already been set for level 1 and 2. And there's tables that, here's a bit of an example of a table for a AQF level 7, someone who entered with a 4-year degree. If they are currently, health professional employee, level 2, pay point 2, they will map across to 4th to 6th year. Like it tells you how to map it. You can't go less, but you do need to double check that no one is meeting any of the level 2 criteria, because if they are, even though they map to level 1, you will have to move them up to level 2. So how will existing level 3 and 4 employees be treated? So if you're currently a level 3, you actually have to compare, for anyone who's currently a level 3, you have to compare them to all the definitions in level 2 and 3. So you have to look at the definitions at level 2 and look at the definitions of level 3 and match them to the correct level. So are they, regardless if they're level 3 now, if they are meeting the criteria for definition for level 2, then that's what they will go to. If they are meeting the criteria for level 3, they'll go to level 3. If they're being mapped to level 2, you'll need to identify if they got more or less than 5 years of experience at that level. And level 4 employees are mapped directly to level 4. A lot of employees sort of top out at the top of level 3. They never actually meet the criteria for level 4. And it was part of the confusion of that award, is that employees would automatically just continue on through level 4. But there was specific criteria around level 4. And again, I think this overall is a much better system. There's a question, do we need to update employment agreements? Now, last night when I did the All Industries webinar, we sort of said, yeah, not really. And I would say usually not. However, it might be a good time to do it as part of this transition process. So, look, if you haven't looked at your employment agreements for several years, certainly if they're older than 2023, you should be at least looking at them, and it's probably a good time to update them. But you don't necessarily have to give somebody a brand new employment agreement every time something changes. You can do it through a change of conditions letter. So if all that was changed, if there's really not much of an impact on them from a salary perspective, and that nothing will change, but you just have to kind of let them know that, hey, under the new classification system, you will be classified as level 1, 4 to 6 years out, 5 to 6 years out. Great. You can do that with a letter that just says, please be advised that, we have transitioned you and your new classification will be X. All other conditions of employment stay the same. Get them to sign it so you've got a trail, and that will be sufficient. We're going to be putting together for our package clients some documentation and wording and communication plans on how to sort of talk to your employees about this. But The other thing is it's always a good idea to have a look at your employment agreements, and particularly for particular employees, has their role evolved and changed? Is the way you've changed them? Have you added things to their benefits? Have you changed their role over time? Were you, did they first start as an hourly rate employee and now you're kind of saying it's all inclusive and inclusive of overtime and you never really re-looked at their agreement? Then I would definitely be looking at your agreements. And July is often a good time to do that anyway. We would encourage people to do that on every couple of years just to make sure that they're still relevant. But I also know there's some clients that we have that give someone a new employment agreement every year, but there's no requirement to do that if you're just sort of changing one or two things as long as you document it. So before we open up to questions, I did this a lot quicker than I thought. In here, I've got an action plan for July. So moving into July, and as I said, the webinar we did last night sort of deep dove a lot more into the July process and doing better off overall tests and things like that. So I'll link that when I send this out as well. But you need to review your current classifications, make sure that you're paying people at the right level now, check the new minimum rates once they're published by Fair Work, review anyone who's on an above award salary to make sure they are still meeting the better off overall test. Make sure you update your payroll. I have had a client that went through the process of sending everyone letters and then forgot to actually tell payroll to update it. Communicate any changes to employees. We're going to talk about payday super in a minute, and we're talking about industry-specific changes right now. The other thing that does change on the 1st of July to be careful of and you need to check are allowances. So allowances will often change. Travel reimbursement levels change. So, you do need to check everything that's changed in an award. Now, by the 1st of October, you don't need to have done this before the 1st of July. And I think it's really important to point that out. A lot of people are still panicked about it. And I know a lot of people are like, well, I don't want to have to do it. I don't want to have to do an increase now and an increase later. So they're looking at trying to do an increase in July that will meet the October requirements. Right now, we know that they will be updating the rates in the current award, hopefully in the next week, and publish them in the current award format. And then we don't start doing ours until it's published because, again, there could be a slight difference or even like a few cents out can exponentially cause problems. So we don't start doing final checks until they're published by Fair Work. What we don't know right now, we do know that what's been published in the final determination with the changes will have the 4.75% added to the top of it. What we don't know is when they're going to publish them, because we are unsure, and I do not know, I have not found it anywhere, whether or not when they publish the 1 July changes, whether they will then add in the coming changes and publish them in the award now, or whether they'll wait and in September, just before the changes, they'll publish the rates that are including the 4.75% increase. I do not like personally using figures that are, I'll just add the 4.75 on top. For the purpose of modeling what it will look like, we're actually, for clients that we do it for, we're actually going to model it with 4.75 based on top of the published rate currently if they don't publish the new rates. But we'll be very clear that this will be reviewed again prior to the 1st of October. But what you want to do is all the things we've been talking about, identify which profession someone is in, make sure that they're AQF, understand their AQF level. You could have, in a multidiscipline clinic, people, you might have level 7s, you might have level 8s, you might have level 9s, you might have massage therapists and have a level 5. They will all have their own set of figures. It's not just one set of figures anymore. Confirm their years of experience, determine their classification, review before the 1st of October whether they will need to have any pay rate changes and make adjustments if required. Communicate with your employees and review their contracts if you want to. A couple of frequently asked questions that came up in the registrations I just want to touch on. Do I need to apply the 4.75 plus the HP changes? Yes, because basically they're separate things. The current award is what it is. It's what's published on the Fair Work website. That will have 4.75% applied and published by the end of this month. That will apply until the 1st of October. That's the rate till the 1st of October. What is being in the final determination and what will be published hopefully sooner rather than later will be the new rate that you will have to pay from the 1st of October. or at least make sure that you're still meeting that. We did a number of modelling with a couple of our multidiscipline larger clients based on the first draft determination. We actually went through a process of going through and applying it and see what it would look like. Now, the clients we were working with are all clients that don't pay right on the award for health professionals. They pay above award for whatever reason. They paid quite well. Went through, I think, 4 or 5 different organisations, and I'll be brutally honest, we didn't see a lot of huge changes. Like there wasn't many that were going to drop out from being, particularly if they're around the AQF7. AQF7 is probably the closest to the current rates right now. And some have gone up and some have gone down. So it's really impossible to say this is what the outcome's going to be. It's going to depend on your profession. It's going to depend on the professions within your business. But you do have to apply both changes. You will have to comply with the 1 July rates until the 1st of October. And then after the 1st of October, you'll have to comply with those new rates. And those rates will go up indexed every year over the next 4 years. And we'll also have that whatever the future increases put on top of them. That is how they're going to make the adjustments to bring it in line as part of the bringing that gender equality change in. They're not going to do it all at once. They're going to do it over 5 years and just gradually increase. Do I need to stay above the award? No, you need to stay at or above the award. As long as you are paying at or above the award, that is fine. But if you're paying right on the award, you need to be making sure that if someone works overtime, you pay them overtime rates and penalties whenever that applies. You have to be paying leave loading. You have to be paying allowances. You cannot say things are inclusive if you're just paying the minimum rate. Will everyone receive an increase in October? Not necessarily. That will depend on once the rates are published and you check against what you're already paying. And if you're already paying above that, you don't have to make a change as long as you're still paying legally. Can employers refuse to move across? No, no. The award is changing. Every man and his dog's had a chance to have their say about it. No, employees cannot move across. It will happen automatically. Even if you ignored it as an employer, it would still happen. You would just be increasing the likelihood that you could be underpaying if you haven't checked it. And will employees hired after 1 October use the new structure? Yes, everyone will. So if you've got a new employee that starts after the 1st of October, that's what will apply to them. If you've got an employee that started beforehand, then you need to transition them with the transition mapping that's set out in the final determination. But everybody's going to be on this from the 1st of October. That will be the system. The old system will go away, never to be thought of again. Couple of final tips. Please don't trust Google. When you're checking pay rates or classifications or entitlements at any time of the year, always use the Fair Work website. If you Google an award, there can be PDFs that are saved on old websites. There can be articles that link to old things. You know, it's how you know that you're always using the most current version of the award. And it's always good to check the award and the pay guide. Like, the award is giving you details about things, but the pay guide can help you be more specific to rates. And if you are under a particular award, you can sign up on the Fair Work website to get updates emailed to you whenever there's a change to that award. I get quite a few of them, and it might just be, hey, we've made a slight adjustment to this. And these can happen across the year, so it's easy to miss them. Whether it's Google or AI, yeah, they can return old data, particularly AI. So again, depending on what AI you're using, it may be using stored data, and you don't know, what it's referencing. So don't just rely on that. At a minimum, if you want to use AI and ask it a question, I would at least link the most current award to it and then ask the question. But honestly, my preference is always to go straight to the Fair Work website. How do you know it's the most recent version? Down the bottom there is a bit of an example. When you open up the award live on the website, now you'll see here, it currently, for this award, this was as of yesterday, the Clerks Private Sector Award, it is updated with amendments up to and including the 23rd of January. We basically hit refresh on these until the new rates drop from next week onwards. If that date there is not saying 1st of July or 30th of June 2026, it's not going to have the new rates in it. And you also have this bit on the side here when you're in the live award where you can find the most recent pay guide, but you can find previous pay guides. So if you're ever in a situation where you need to go back and check something because maybe someone's made a query and you want to find the old rates, they're always available to you on the website as well. But always check that date, and don't download and save PDFs of things, because I've seen so many people get into trouble with that. Final thing, Payday Super is coming. It's coming whether we like it or not. We are not payroll and ATO, we are Fair Work. So, but it's really important to remember that the current approach of paying wages weekly or fortnightly, but being able to pay super quarterly is going from the 1st of July. The expectation is that if you pay weekly, then you pay your super weekly. If you pay fortnightly, you pay your super fortnightly. So double check your payroll system's ready if you do it internally. Have a think about how it's going to affect your cash flow. Make sure that someone is monitoring it for compliance. I'm getting my bookkeeper and accountant are working on that, and but make sure you're aware of that in your business. There's a few other things we included in last night's one where we were just sort of talking more broadly about the middle of the year increases. So a couple of key takeaways. It's structural change, not just a pay increase. They don't start till the 1st of October. The decisions you make around classifications will be quite critical and you want to try and get them right. And the more preparation you do now, the easier it's going to be as you hit towards that deadline. I can't believe I actually finished a little bit early. So what I'm going to do now, before I jump onto the questions, we will be, we've got quite a few questions, great. We will be helping clients. If you're one of our HR partner clients or Essentials Plus clients, you probably have already gotten something from us around this process. And part of that will be helping you with the transition as well. If you would like our assistance with either 1 July or 1 July and transition, we're doing a package with them together. We'll put some information about that in the email when we send the recording, and we're more than happy to help you. But we've got a very specific process because we're getting a lot of people asking about that. Okay, question 1. What happens if someone is a provisional psychologist or doesn't yet have a master's degree, or if a psychologist was trained under the old 4+2 and doesn't have a master's and they still AQF 9? Yes, they are. But when we had a look at the rates before the increases, the AQF 9 entry level 1 pay point was the same as the master's degree pay point in the current system. But yes, and the Psychologists Association did not actually come back with any questions or any responses to the final draft. So, but yeah, they're AQF 9. It doesn't matter if they come in with a master's, they're AQF 9. Is there any change on the 1 July to the mileage compensation rate? There will be. It's not published yet. So we can't tell you that until it's published. How do admin support fit into the new AQF structure? They don't. Support services still has the same existing structure for their classification. For years experience, do career breaks count, i.e. maternity leave or other career breaks? No, it's years working in that profession. So that's a good question, because often you might have someone who, they might go off. I know a physio I used to see went off and became a firefighter for a couple of years, and I believe he's back practicing again. Those years don't count. It's not just years since graduation. If someone took a career break for a year and went traveling, that year doesn't count. It's years working in that profession. And if they were not working in private practice and went and worked in, say, education or academics, that's not practicing that profession. So, and they would have been under a different award, so that wouldn't count either. What if the person works for you only part-time? Does it increase or pay reduce on how many? No, when you're calculating, just because they work part-time with you, this new one's not going to matter if it's part-time or full-time. If they were working for you or someone else or 2 or 3 people, won't matter. As long as they were working in the profession, that's what counts as the time. So if they're part-time for you and part-time with someone else, we no longer need to muck around with trying to work all that out, because it'll just be, well, you can see that they were working every year, whether it was part-time or full-time won't matter. That's how many years it will be. And if they haven't had any career breaks since graduation, then that will tell you. If you set up your job requirements and you're more advanced, so for a receptionist, does their prior more basic experience still count? If you're set up and job requirements are more advanced. I'm not quite sure what that question means. The support services are very much around the role that the person is doing, and the role that they're doing is what sets the levels within that. I haven't gone deep dive into support services today because they're not having any big changes. I would read the definitions for support services and ask yourself, it doesn't matter. I mean, sometimes we get questions like, oh, well, they've never worked in the medical field before, so they should start at the bottom. Well, no, if they've worked in reception roles similar to the role that they're working on, just because it's not in your industry, doesn't count. Health professionals are different to support services. We don't require any particular minimum qualification for allied health assistants. We would love allied health assistants to be added to the new structure. It hasn't. Um, Look, it's one of those things where the term allied health assistant is used quite broadly, and there's a lot of different people who use that um, basically term, but it could be someone who's actually degree qualified, or it could be someone who's not. It's more about what the individual's doing, but also, yeah, that's a really complicated question. But that allied health assistants don't have their own thing now. I know they've now got an association, and they're trying to get that built into the award, but for now, it hasn't been added. If an employee applies for a graduate speech pathologist role and they have a master's degree, do they start at AQF 7 or AQF 9? Well, if a master's degree is AQF 9, then they start at AQF 9. Um, 3-year degree, I think, is AQF 7, and a 4-year degree is AQF 8. If I get that wrong, I'm sorry, don't take that as gospel because I've looked at so many figures in the last couple of days. But if their qualification, you can check the Australian quality framework, qualifications framework to double check what their specific requirement or like qualification is and what it's matched to, and that will tell you. Is time off for parental leave excluded when counting years of experience? Yes, because they're not actually working in the profession while they're on parental leave. It'd be no different to like taking a career break and traveling. What is considered work in a specialised clinical area? How is that determined? Good question. Um, Look, there is no, I can't remember, this covers multiple, like all professions within allied health. And I've had some interesting conversations with people at industry bodies that maybe industry bodies should be providing some guidance for different streams of what that looks like. The sort of things that I'd be looking, that, we've sort of developed some questions that we're going to ask, and we're going to ask questions like, so is someone working in a specialised clinical area? So are they working in an area that is, we're charging more money for because I'm going to use physio. Like if you've got a physio and they're known as a shoulder guy, they people within the clinic will refer to them because they're sort of expert on site on shoulders. People external to the organisation will refer to them because they're an expert on shoulders. Do you charge more for them because of their specialised clinical area, because they've got more expertise? There's no magic formula, but there are some questions that you can ask yourself to sort of work that out. But Amy, you're one of our clients. We can help you with that. For specialists and senior clinicians, if the clinician has had a special interest in a specific area of work and develops more knowledge than this other than their area of work, does that make them a specialist? This seems like it wouldn't be the case, but um, look, if they're not using it in their job, I mean, you can gain a special interest and do all this extra PD, but it's not required for the job that you're working in. So, you know, if they're not using that knowledge in your clinic and working with you, like then it doesn't count because again, that's not the job that they're doing. When it comes to things like those specialized clinics where they say, a good example might be a clinic itself that specializes in, say, for example, eating disorders. And they only hire people who've got a certain number of years experience with eating disorders and things like that, then everyone there might be seen as a level 2. We will be able to get assistance with classification from our team if we get stuck. Do you mean our team here, similar to how you assist with the boot? Absolutely. There'll be information in the email that goes out that where we can just do this for you and ask you all the right questions and get it right for you. When do you start counting user experience? From October when the changes come into play or back to when the person started their current role? You start counting from the time they enter the profession. So if you're looking at putting where people fit in level 1, if they graduated in 2023 and they started in 2024 and they worked in the profession 24 and 25 and 26, they're in their 3rd year. If they get classified as level 2, you're only looking at the number of years that they've worked in a role that fits level 2. So they could have had 10 years experience before that, but only the last 2 years they've worked in that role, then it's only 2 years at the level 2. If a team member is everybody's minimum, the minimum is set for all of the classifications now will continue to go up every year by the minimum wage increase, plus whatever additional adjustment has been flagged as part of the gender review for the next 5 years. Chat functions disabled. Yep, this is where we want to write. So when you're looking at a number of years at level 2, for example, we just have to trust the information the team leader gives us around how long they've been a supervisor for. For example, if they've worked elsewhere for 2 years and told you they supervised others in their job, and they've worked with you for 3 years and they would have had 5 years experience at level two. If you hired someone because they have had 2 years supervisory experience and you reference checked, and yes, they've been working in supervision for 2 years, like supervising for 2 years, look, it's like anything. If someone applies for a job, they can tell you whatever they like. You've got to do your due diligence for new employees coming in. Um, I think that it's one of those things where, if someone's got 3 years of experience, 3 years out and is telling you that they've been supervising for 2 years, then I would question that. What does that actually mean? What do you mean by supervising? What have you actually been doing? Are you supervising others? Because I mean, your professions, where people, what's relevant and what's reasonable. If you have a query about it, if they're telling you, no, I've definitely been supervising people before now. Now they could tell you that in their resume, it doesn't mean it's true. Reference check and ask those questions as part of your reference check, or ring their previous employer and just clarify, can I clarify what role this person was holding when they were with you and what their role was? Yeah, you've got to do your due diligence, but someone could write whatever they want in their resume, and if you don't check it, you're taking it as verbatim. They could change dates and things like that. Where do managers sit within the framework? Oh, you're not practicing at all, but maybe no health background. Well, that's depends on the role. I mean, are they? Well, if they've got no health, if they're not a health professional, they're probably under support services. So if they're not a health, if they have a health profession, if they're a health professional, they'll be under the health professional side. If they're not a health professional, they'll come under the support services side. So yeah, if they're not actually a qualified health professional, then they won't qualify for that anyway. Is the expected new classification will also apply to support staff? As I said, that hasn't, they haven't changed that. That has stayed the same. Oh, sorry, just I'll cover the last question. What if an individual has 6 years experience but has taken 2 years out of practice for maternity leave? Does the FTE standard apply in this instance? No, FTE is going from the 1st of October. So if they've got 6 years experience, but 2 of those they were not practicing because they were on mat leave, then they have 4 years experience practicing. It's practicing is the term. Is it worth reviewing position descriptions to ensure the position descriptions clearly align with new classifications? Yeah, I do know a couple of our clients have already done a bit of work to kind of, they have a feel they've got their own structures they move through with titles and things, and they've kind of made some adjustments to that to sort of reflect these changes so it won't be confusing. Would an OT or physio working in hand therapy clinic automatically be classified as a specialist, or would they require further accreditation as an accredited hand therapist to be classified as a level two? Same question for OT working with lymphotherapy. There's going to be ones you'd have to talk through one by one. I can't be too general, but if you're a hand therapy clinic and you're hiring people because they have X amount of years experience as a hand therapist, that's different to your hand therapy clinic and you're providing years of training first to that person. Yeah, again, when I was talking about the classifications, like the extra qualification doesn't automatically trigger it, but it can be part of the discussion. Can the boot test really be used with the recent court findings? Some people need to meet their award entitlements over each pay period. Okay. I didn't want to go into this too much. The latest court finding is being appealed. So some of you might remember a couple of years ago, there was a court finding that changed the rules on personal leave and how it was accrued. And everyone lost their mind because it was different to how every pay system did it, but it got appealed and overturned and clarified. This recent court case on the boot test, I believe, is going to go the same way. They're looking at Fair Work's looking at legislation to clarify it. I'm saying to people, just hold your ground at the moment. If you've got an offset clause and you're doing all the right things and you are sure and you're paying people above it, wait and see when this gets it. There's like 5 parties that are appealing it. Almost all the industry bodies are appealing it. What I don't want everyone to do is rush off and make a whole heap of changes to only find that it gets overturned. And I think, and Fair Work are already working on ways of clarifying that. So, yeah, technically speaking, yes, that's what that new ruling has said. But that new ruling is against everything that way things have been done and actually contradicts the way annualised salaries are actually set up in some awards as well. So I would watch that space and not make any grand changes to that. My understanding is that from October, we don't have to pay the full amount of the new rate, but instead there is some kind of transition period to help employers move it. That's already been worked in. So the rate that's been published is the rate for year one. There's going to be increases outside of the minimum wage increase for the next 4 years. They are transitioning it in over 5 years. The rates that have been released have to be paid and they will need to have the 4.75 added to them when it's published. That's how it's being transitioned in. Because for some particular areas, there's bigger gaps than others. As I said, some went down, some went up. It depends on your profession. But if that's already being done. You don't have to think about that. Next year, they'll say, here are the new rates, and they'll add the rate, the minimum wage increase to it again. Does the parental leave impact progression after October 1? Again, I mean, it's not included now, because you don't work the hours. And again, when it's practicing in that profession. So whether you're on a career break, on holidays, whatever reason you're off, if you're not practicing, that time doesn't count. Previously, clinicians were the only employee in that profession discipline within an organisation. They were moved up to a higher level for usual day-to-day work responsibilities. Is this still the case? Not quite sure what you mean by that question, Talia. I'm happy to talk to you about that offline. Can high duties allowances continue if skills don't quite fall as part of the classification, i.e. small additional task for a fixed 12 months? Again, that's probably something I'd need to know the details about. And have Fair Work provided a window of time they anticipate publishing? No, they haven't. I wish they had. As far as they're concerned, they're published because they're published in the final determination. What they haven't said is, as I said, I don't know whether they'll publish them when they publish the 1 July increases and just put it there already and just have it there with the new rates ready to go, or they'll wait until September and publish the new version when it's about to come into play. I don't know the answer to that. I wish I did. Oh, hey, Michaela. Yeah, but L4s who fall into L2 and 3. Okay. Part of the reason, if you've got an L4 that should be at L2 or 3, map them to L2 or 3. The thing is, a lot of people just continue to progress people through. Technically, you can stop people at the top of level 3 because they're not meeting the criteria. Level 4, sorry, currently has very specific criteria. And if you're not performing in those roles, they would top out at the top of level 3. So what I would do is, even though they're called level 4 right now, as I've talked about earlier, go back, map them through. But if they don't meet the criteria, and this is why it's always been confusing for people, right? Because it doesn't specifically say that in the award, but in practice, if someone's not meeting the current criteria for level 4, and not many people we see are, then they would stop at the top of level 3 because they're not meeting the requirements of the jobs at level 4. We're happy to talk that through with you, but it is a tricky one. What happens if you have a staff member who work full-time and lead programs but is reverted to part-time and level 1 duties? Do you have to recognise the higher level? Well, I mean, I would map them on what they're doing now. Like, we're not going to be talking about what they've done in the past. We're going to be talking about what their role is now. So, yeah, again, some of these might be hard to answer because they're going to be more specific to individuals. How does supervision of allied health assistance work? Any HAA program needs are written by AHP, so AHP only write these if they're level 2. So, well, it depends. Are they managing them or are they writing stuff for them? I mean, there's a difference between managing someone. Managing someone is you do their performance reviews, you give them performance feedback, there's a lot that you are responsible for them. If they are just the person who writes the program for them and assists them, that's not supervising them day to day. So I wouldn't imagine that would put them at level 2. Physios are 4-year degrees, but AQF 7. Again, I'm not going to comment on what levels people ended up at. Everyone had their chance to talk about it. AQF 7, again, there were so many submissions. They're all online if you want to read them all. What's done is done. It's not going to be changed. If you have issues with it, talk to your association and get them to go back. But yeah, I'm not going to. We're at the point where we get what we get, and we've got to move forward. Speech pathologists who have done 2 years general and 2 years masters, are they considered to be started at a high AQF level, even though they have done the same number of years? I would look at their qualification and see where it maps. Again, there's not always going to be a cut and dried answer to everything. I would need more information. This is where I would go to your association and say, what does this mean? Because do they have a master's? Is their qualification that they hold a master's degree? If it is, then they'll be considered a master's. It's up to what the AQF consider it to be. So is this based off a calendar year of October to October now? No. No, I mean, it's from the time that, yeah, that's an interesting question about like, if someone's off from October for 11 months of the year and then they return as work for 1 month, does it count as 1 year of experience? Well, they'll probably worked 11 months of the previous year. So when you put that 1 year together, that's still they had 1 year out. That's still 1 year less than when they first started in the profession. And you do that from the time they started in the profession. So if they started in a role in January 2022, when they took that 12 months off, it's just taken off. So, they started in January 2022 in the profession. So they worked 22, 23, 24, 25, and halfway through 26. So they're 4.5 years. They took 12 months on mat leave. That brings them back to 3.5 years. When those dates happen is not really going to matter. Can an organisation still assign a KPI to each level? I'm not sure what you mean by that, Talia. I'd have to get you to, hang on, e.g., level 1 with 1 year experience, 15 clients per week. You can assign whatever KPIs you want. I mean, the award is there to set the minimum requirements of salary for everyone. It's not the be all and end all of everything. You can set whatever system you want internally on that. But a lot of people who have set things up in the past are re-looking at them to kind of think about, you don't have to have them linked to the award classifications. The award classifications, they're purely to work out whether someone's paid correctly. That is my last question. If anyone's got anything else, please, hang on. In the next HP transcript increase is going to happen on the 1st of October. No, it's going to roll back to being the 1st of July. They delayed this one by 3 months just based on a few things and the lateness in getting it out, but it will be in line with 1st of July moving forward. I say that, who knows what happens in the world in the next 12 months, but that is the plan, that it will revert back to the 1st of July. Oh, thank you, Ben. Another question to me. Thank you, Carly. Such a crazy busy time, and we appreciate your support and team support. Oh, thank you so much. We really appreciate it. Oh, thank you all for your lovely words. Yeah, look, thank you. We're here. You are more than welcome to reach out to us. As I said, there will be a lot of information that we will send out in addition to the recording of this. Might be a good thing to show your employees if they start questioning things. We will also be putting out a series of articles and shorter videos over the next 3 months in preparation. But if you're one of our HR partners or you're one of our Essentials Plus clients, we'll be doing this for you automatically. We're going to start that process as part of this mid-year review for 1 July. We're not going to do full boots on the new rates, but we are at least going to tell you what someone's been mapped to. Because we don't want to hold up sending you the 1 July information. So it'll say this is what they've been mapped to, but if we have any questions about the mapping, we'll have a link to make a time to really go through and clarify them for you. And then we'll revisit it again in September just before it all happens to make sure it's all ready to go. So it's been a pleasure talking to you all today. If you have any questions or need anything further, please reach out to our team. We're always happy to help. If you aren't a package client and would like us to help you, as I said, the details will be in the email that I send. Please don't just email our team and say, can you help with this? Because you're only going to get sent back to what I send out anyway. It's a lot of people reaching out for our help. We're more than happy to help. We have a very set process this year to make sure that we can stay on top of it. Thank you very much for everybody for your time, and we will see you next time. Thank you.